misinformation is very, very dangerous. Majority of the cancers come between 45 to 55 years. Yes, it is a lifestyle disease, and lifestyle has a very, very important role. The entire human body is made up of many bricks. Cervical cancer was a leading cancer for a long time in our country.
Let's break the fear around the word cancer. Welcome to BHIO Healing Talk by Bharath Hospital and Institute of Oncology. I am Kavya. Today we are joined by Dr. Madhavi, our Senior Radiation Oncologist, to uncover the truth, the myth and the hope behind cancer care. As we answer some of the most common questions people are asking on Google. What is cancer and why are more people asking about that than ever?
Yeah. See, people have to understand this. Cancer is not one disease as such. Like just as a building is made up of many bricks, the entire human body is made up of many bricks, and these bricks are the cells. So each organ has its own set of cells. Liver cells, pancreas cells, brain, lung, kidney, etc. So what happens is cancer is by definition is called a purposeless proliferation of the cells. It's an uncontrolled purposeless proliferation. Proliferation means growth. One of these cells, due to various changes within the genetic apparatus, either caused by birth or by acquired during the lifetime, that becomes a wrong genetic message. So because of this wrong genetic message, the growth will become uncontrolled, purposeless. And it's a growth which totally invades the neighboring cells, and that is cancer. So what happens is the various cancers, the treatments differ, the types differ, the symptoms and signs differ in cancer. So one blanket statement, cancer is cured, that's not which cancer, what are the types of cancer, what are the factors for each cancer, they're all different. But basic thing common to all cancers is that something goes wrong in the genetic apparatus, and then this is uncontrolled, it's a purposeless growth.
How much of cancer is about genes and how much is about lifestyle?
See, now why people are talking more and more of cancer is because we are seeing more longevity now. People are living longer. Because in the olden days, people would die of tuberculosis, or many women would be lost during childbirth itself. So nowadays, the longevity has gone up to 80, 90 years because of so many medications, etc. As the lifespan increases, we are exposed. So many chemicals and all, the opportunity for exposure is much more. So we are seeing these diseases also now. So your second question is cancer a genetic disease? Yes. What are the hereditary cancers? Around in all cancers combined, 10 to 12% are heredity. That means you were born with the defect. Your genes, you know what genes are? Each cell, I told you, each brick is a cell.
Yeah.
This in the center of the cell is a nucleus, and that is where the genetic material is there. So this defect may come from fathers, grandfathers and all. That's a genetically inherited defect. That only 10 to 12% of all cancers have. But basically when you think cancer, in the general statement you can say cancer is a genetic disease, because whether you get it from hereditary or when you acquire it later, it is still in the genes only. The trouble starts in the genes only. You got it?
Yes.
The trouble is in the genes only. So that way, broad term we can say yes, it comes from the genes, but acquired genetic diseases around 10 to 12%.
Okay, what about the lifestyle?
Lifestyle is very important. Why lifestyle diseases? All the diseases we are seeing in this modern day. Why alone cancer? Aren't we seeing many cardiac deaths also? The cardiac deaths, the hormonal changes, inability to have children. See, so many problems which we are seeing nowadays are all a result of the lifestyle changes. That is, proper eating is not there, balanced food is not there, timings are not maintained, very few people have good exercise patterns, and loss of sleep. They work well into the night. What our own system says, proper balanced, home cooked, fresh, all vegetables, fruits, reduced meat, more green leafy, plus all fruits of all colors, which all have protective agents. That is what is required. When you look back, you see how many people are doing all that. Yes, it is a lifestyle disease, and lifestyle has a very, very important role. In some malignancies like colon, etc., exercise can reduce the risk of cancer by 10%.
Which cancer types are more curable? And why do some scares us more?
No, some, see, as I told you, no, cancer of different organs is a separate, like a personality in itself. Some cancers are curable, yes. For example, some of the curable cancers I can say is thyroid, breast, all. This bottom line is, if early, all can be cured. But the more curable varieties are the thyroid cancer, breast cancer, Hodgkin's lymphoma. They are all the curable, and also prostate, endometrial cancer, cervical cancer. These are all, if detected early, they have very, very good survival rates. If the person survives, if a 50-year-old survives for 30 years, that means he is as good as he spent his lifetime without recurrence. You understand?
Yes.
That can be considered a cure only.
ಸೊ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಕೇಳಿದ ತಕ್ಷಣವೇ ಜನರಿಗೆ ತಲೆಗೆ ಬರೋದೇ ಇಟ್ಸ್ ಎ ಡೆತ್ ಸೆಂಟೆನ್ಸ್. ಅದರಲ್ಲೂ ಅವ್ರು ಏನಾದರೂ 4th ಸ್ಟೇಜಲ್ಲಿದ್ದಾರೆ ಅಂತಂದರೆ ದೇ ವಿಲ್ ಥಿಂಕ್ ದೇ ಕಾಂಟ್ ಸರ್ವೈವ್ ಫ್ರಮ್ ದ ಕ್ಯಾನ್ಸರ್. ಬಟ್ ನೌ ಡೇಸ್ ಟೆಕ್ನಾಲಜೀಸ್ ಆರ್ ಮೋರ್ ಇಂಪ್ರೂವ್ಡ್ ಟುವರ್ಡ್ಸ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್. ಸೊ what does the 4th stage is really mean today?
See, 4th stage is a stage where most of the doctors don't like to see the 4th stage. There's no doubt about that. So that is why all our cancer screening, education, awareness programs and all that, we don't want to see people coming in the 4th stage. So cancer means cancel does not hold good nowadays. ಯಾಕೆ ಅಂತ ಅಂದರೆ we cannot claim that we are curing all cancers even in stage 4. But the difference is we can control it for long periods is what we have realized. Control of cancer. Cure and control are two different words.
Yeah.
We are controlling for longer periods. Now diabetes ella iroru, how long are we controlling? 40 years, 50 years? They're living with diabetes and hypertension also. So now the difference is in our technology, in the sense we found out what are the genes which are playing this mischief. Then we find medicines to block those parts. So eventually the cancer cell also will learn to bypass that. And then what mutations have occurred, then we are trying to block that further down. So because of all this additional information and technology and targeted therapy, we are able to control for fairly long periods. So cancer's stage 4 is not cancel.
Yeah.
With good technology, with good advice and with proper treatment, it can be controlled for long periods, fairly long periods.
Okay.
Just control alla, the person themselves also can have a good quality of life, normal life.
So last question we discussed about like curable and controllable everything. So treatments has changed so much. So what's new and worth being hopeful about?
What is a new treatment? The new treatment techniques have come up in all modalities of cancer. For example, in surgery, they have more precision instruments, less damage, and the parts are removed. Similarly, in radiation oncology also, I'm a radiation oncologist. We have new technology. Our machine is very sophisticated machine. So it delivers the exact dose of radiation to where it's required. Sparing of normal tissues is occurring in a much, much better way. Because of the computer generated images, because of lot of technology, the same things we are doing in a much, much better, in a more accurate, targeted, pinpoint fashion. Okay. So similar in chemo also. So that the entire treatment is only called targeted therapy. So we are just going to the root of the problem in a better way. So all this is new technology which has come up in a very big way in the last 10 years. So when in my own lifespan, when I compare how it was even 30 years ago, I see lot of changes, lot of hope, lot of optimism in the last 10 years, more so in the last 5 years, and more are coming up. So I feel it will be transformed in the next 10 years. So many more things are coming up.
What are the side effects nobody told to you, and how do you live through them?
So see, what happens is, since I'm a radiation oncologist, I'll start with radiation oncology side effects. So no treatment can be delivered without any side effects. So however sophisticated the machine is, many patients also ask this question. You said you have the latest machine. That means namge treatment togoluvaga, so we are not going to have any gantlu any further, or depend on which part of the body we are giving, or pain abdomen, or horgane ಏನು ಕಾಣಿಸಲ್ವಾ. So many things can be reduced, but I will never say like we can completely eliminate some side effects. So whatever glorious picture we paint, there will be few side effects, but all of them are tolerable is what I would like to give the message. So there is nothing, it's a shock discovery that we didn't know we had to go through this, it is so awful. It's not like that. Very, very tolerable. Even for chemotherapy agents, so many cytoprotectants have come. Antiemetics are very good. Pre-medications are much better. So even in the surgery, since the field touched is small, the pain and the time to recovery is also small. Healing is faster. And then from the patient side also, if they are in good health, they cooperate, they undergo physiotherapy, they also contribute, then it really comes, they come out very fast. So I won't say there is some unexpected horrible side effect waiting, which is they will discover only later. There's nothing like that. Whenever a patient comes for treatment, everything is discussed up front.
Okay.
These are the things you'll have to face. So because psychological support is also important, that is also given. They are also counseled so that they're mentally ready for all treatment.
Once treatment ends, what happens next? Will cancer come back?
See, we can never tell any cancer patient, however early they come, that's it, you're done. You need not come for checkup rest of your life, and then we can never say that to anyone, okay? Because they still have to live in the same environment. Of course, the notable known risk factors we tell them to avoid. Despite that, many of the risk factors, for example, pollution and all, are not entirely under our control. What we eat, what we drink, what is spray for the vegetables and all. So that means there will be some amount of exposure. And so there is a period of close follow-up. That is for example, head and neck, 2 years and all. It's a cut-off period, very aggressive tumors. Once you cross that, then it's a 5-year period. Then the 10-year. So we give them the schedules for follow-up. As it becomes farther and farther away, the interval checkups become longer and longer. But in no time can they say, that's it, we are done. Because we have seen many double malignancies. Head and neck patients, what happens is because of the smoking habit, the side effects are seen all over this area. So once in the right cheek. So people who have been cured of the right cheek buccal mucosa or something, come up with tongue or something after 8 years. And then maybe the food pipe or something. So regular checkup is very, very important. Follow lifelong, I would say.
Okay. So,
one more thing I want to add, breast cancer also, however early they come up, as I said, the same factors are also exposed to the thing. Opposite breast also can show. So many people think once they get it in months, they're done. Some 15 to 20 may develop in the opposite breast also. So follow-up and check-up throughout life is very, very important.
if I get some symptoms also, I will go and Google it. What is it about? Rather than going to a doctor. So, how do I spot a myth from a fact?
See, I would always say go to the trained person because they have done many studies on that. This Google or I don't want to use the words maybe, online information is very, very dangerous. Self-treatment is going on and many people are landing in stage 4 because of misinformation. So I appeal to everybody that please contact the right professional and get the advice. There is no substitute for that. And especially when it comes to any serious illnesses, it's always better to consult in person. And earlier days we won't say this much. Many people are misled, I would say. Misinformed, misled. And that is leading to more advanced states, which should not be happening actually.
Yeah, that's also true. We give one thing like we have some symptoms and it shows some other thing.
Correct.
And we get stressed out.
Correct. There is
without any reason.
There is no substitute for meeting a properly trained professional.
True. Okay. Breast cancer seems to be the most talked about cancer in women. How should women watch out for?
No, about breast cancer only I want to tell you. See, before the top leading cancer in my own practice, some 20 years ago was cervical cancer in the rural areas because of improper hygiene, improper knowledge and other things, and not going for screening. But without a doubt, because of lifestyle and other things, breast cancer is growing and growing. Every year by year, I would say. More than a decade. In a city like Bangalore, we're seeing heaps and heaps of young breast cancer people. So because of so many radical changes in our own lifestyle in this previous decade or so, a lot of things has affected the disease patterns also. What the women should be aware is, first of all, lifestyle is not just a mantra you just repeat. You really have to sincerely and seriously follow. Find out what's good for you, proper dieting, proper sleep, proper rest, proper eating patterns, and then awareness about the disease. Why should you be aware? Should we know about cancer, we can live in peace. The word itself scares us until they can tell us. But know your enemy is the important thing, isn't it?
Yeah.
When you know that it's out to get you, you may become a victim. So knowing all about your enemy is a nice thing. You can be prepared. So for all women, what I would say is simple guidelines are: be aware, breast cancer is the leading killer in women in our country especially, and many come up in the last stages. So please be aware. What is awareness? 20 years onwards, since it can come in that age, please be breast cancer awareness is self-awareness is what I would like to tell. Because in our country like ours now, even going for a checkup may be expensive. So what I would say is be aware of your breast, learn to palpate, learn it from a proper professional, do it yourself. 1 week after your menstrual cycle is over, we're ready to teach. Then up to the age of 35, 40, if there is no family history, and once a year or once in 2-3 years, get it checked by a clinician. Many girls find lumps. When there's any lump, don't panic. There are many types of lumps. All lumps are not cancer also. Please come and get the advice. And if any scanning report or something says it's unlikely to be cancer, please don't get misled by that also. We do a cytological examination. Histological confirmation is required. Any lump, just by its appearance or look, we should not call it a malignant or benign. There is a method to go about. Then if there is any family history or something, start it early. Take it seriously. Majority of the cancers come between 45 to 55 years. That is supposed to be the peak age for high risk. But now we are seeing earlier people also, and later also we are seeing. So what we tell is 40 onwards, 40 to 45, maybe once in 2 years or so. That is, it depends on their background, whether they're obese, what was the menstrual history, what was the family history, all these things come into it. Because breast cancer itself is multifactorial. There is no one factor for that. So keeping all that in mind, so 40 to 45 months in a year or 2 years, 45 to 55 every year, mammography, ultrasound breast, if necessary, MRI, etc. And then 55 onwards, depending on the advice your doctor gives, you can sort of taper it off. But lifelong, this awareness should remain and the checkup should remain.
Okay.
Not with fear, but with proper awareness, so that we can really catch it early, and breast comes under one of the curable cancers. So we should not waste this opportunity. What I again want to tell is, breast is not a gland hidden deep inside the body. It's very much outside the body, accessible for all sorts of checkups and follow-ups. So such an organ, nobody should die of cancer of that organ. That's what I'd like to say.
So after this breast cancer, the another common one is cervical cancer. What causes it and how can it be prevented?
Yes, cervical cancer was a leading cancer for a long time in our country because of various factors. Now breast has overtaken it, but we are seeing the second highest is still cervical cancer. Rural areas, it's much more than in the urban areas. So what cervical cancer, the causative agent is human papilloma virus. Majority of them are by HPV virus. There are other factors, other types too. But now, since we know this is the majority causative factor, there are two ways of safeguarding it. One is preventing HPV infections. ಅದಕ್ಕೆ ಏನು ಮಾಡ್ಬೋದು ಅಂದರೆ taking vaccines. So from the beginning start off. So what is the age for vaccination? HPV vaccines are available from the age of 9 to 12 years in the pediatric age group. 2 doses are advised. 12 to 18 or even 26, 3 doses are advised. And nowadays, if the people have high risk behavior or anything, they can, it's advised even up to the age of 45 years. 3 doses. First dose is 1 month after the first dose. It's an intramuscular injection, and 6 months for the third dose. So 0, 1 and 2. Okay. So 3 doses have to be taken, and it costs around 2,000. The government so has not yet come up with that, but the Indian commercially available one is 2,000 rupees per dose. It's really very few side effects, and many people have taken. The clinical trials are also shown it's safe. So this is how to prevent HPV infection itself in the first place. And then if you have not taken HPV, then we have to find out whether you are infected by HPV. So there is HPV DNA testing. That's also by smear. So in case you're tested also, positive also, the treatment can be taken for that. And all the people we advise pap smear. So for human cervical cancer, sexual activity onset is the flag for starting the screening. So onset of sexual activity, start the screening program also. Whatever age you're married, 12 years if you're married, it takes a decade for it to, once it's infected, it takes a decade for it to become a full-blown cancer. So if you're married at 12, we used to see young girls at 25. Now you're married later, we see it later ages also. So pap smear is just taking a scraping from the cervix to see whether any cells have changed towards cancer. So many stages are there in cervical cancer, luckily. Mild, moderate, severe dysplasia, infiltrating cancer. So the entire journey takes some time. So in that journey, we try to catch it early. So we can give a good cure figure. Okay. Yeah. So many people say, how long? When we tell them, when we go to the camps and all that, 60 ವರ್ಷ 55 ಆಗಿರೋರು ನಮ್ಮ ಮುಟ್ಟಿನಿಂದ ಎಷ್ಟೋ ವರ್ಷ ಆಯಿತು, ನಾವೀಗ ನಮ್ಮ ತೋರಿಸ್ಕೊಳ್ಳೋಕೆ ಇಷ್ಟ ಇಲ್ಲ ಅಂತ ಹೇಳೋದು. ಬಟ್ ವಾಟ್ ಐ ಟೆಲ್ ಇಸ್, ಇಲ್ಲಿವರೆಗೆ ಒಂದೇ ಒಂದು ಸತಿನೂ ಚೆಕ್ ಮಾಡಿಸ್ದೇ ಇದ್ದವರು, ಪ್ಲೀಸ್ ಗೆಟ್ ಇಟ್ ಡನ್ ಅಟ್ಲೀಸ್ಟ್ ಒನ್ಸ್. ನಿಮ್ಗೆ ಇನ್ಫೆಕ್ಟೇ ಆಗಿಲ್ಲ, ಚೇಂಜಸ್ ಏನೂ ಶುರು ಆಗಿಲ್ಲ ಅಂದರೆ ನಿಮಗೆ ಕ್ಯಾನ್ಸರ್ ಆಗೋ ಸಾಧ್ಯತೆ ಇಸ್ ವೆರಿ ಲೆಸ್. ಬಟ್ ಸಪೋಸ್ ಅಟ್ 55 ಶೀಸ್ ಗಾಟ್ ಎಕ್ವೈರ್ಡ್, ಆವಾಗ ಮೈಲ್ಡ್ ಮಾಡರೇಟ್ ಡಿಸ್ಪ್ಲೇಸಿಯಾ ತೋರಿಸ್ತಿದೆ ಅಂದರೆ ಡೆಫಿನೆಟ್ಲಿ ಟು ದ ಏಜ್ ಆಫ್ 70-80 ಕ್ಯಾನ್ ಗೋ ಆನ್ ಇನ್ ಟು ಇನ್ಫಿಲ್ಟ್ರೇಟಿವ್. ಸೊ ದೆರ್ ಇಸ್ ನೋ ಒನ್ ಏಜ್ ಕಟ್ ಆಫ್ ಲೈಕ್ ದಟ್, ಯು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್? ಸೊ ಇನ್ ದಟ್ ಪಾಯಿಂಟ್ ಇನ್ ಟೈಮ್ ವಾಟ್ ಹ್ಯಾಡ್ ಹ್ಯಾಪನ್, ಅಲ್ಲಿಂದ ದೆನ್ ಯು ಪಿಕ್ ಅಪ್ ಫ್ರಮ್ ದೇರ್. ಸೊ ಇಟ್ಸ್ ಈಸಿಲಿ ಟ್ರೀಟೆಡ್ ಆಲ್ಸೋ, ಇಟ್ಸ್ ಈಸಿಲಿ ಟ್ರೀಟಬಲ್ ಕ್ಯಾನ್ಸರ್, ವೆರಿ ಗುಡ್ ರಿಸಲ್ಟ್ಸ್ ವಿ ಹ್ಯಾವಿಂಗ್. So this is the guideline I would tell for all cervical prevention, cancer prevention.
Okay. Do birth control pills or pregnancies affect cancer risk in women?
See, earlier birth control pills, that's what you ask here. Whether married or not doesn't matter. Birth control pills will have the same side effects. So higher hormone levels were there in the birth control pills. That increased the risk of breast cancer. There was a fear. And there was a suggestion that it may increase the risk also. Similarly in women, but nowadays they say the pills available nowadays are very low dose pills. So the risk is not high. So one more factor I would like to mention is, but please be aware, if you have a family history, if you have any risk factors, please be aware that there is a small risk in these tablets. So please get it checked with your doctor before taking is what I would suggest. Instead of just scaring them that don't take, I would say keep the history in mind and then be aware of these risks and then take. So same point applies for in women when they attain menopause. Because of all the various menopausal symptoms also, that is one situation where hormone replacement therapy is being advised by many people. For joint pains, looking old, wrinkles, so many things which hormones were protecting us against. Estrogen gives a lot of protection. So when you are before taking that also, please be aware there is a small risk involved, and if you have any of these already pre-existing diseases, be careful.
So now let's answer some myths and facts. The first question is, many believe cancer spreads if you talk about it. Is it true?
It's neither contagious nor and spreading awareness is very good information which is helping you. Just mentioning the word cancer is not going to put you at risk. It's just a psychological fearful state. There is no actual risk from that.
Okay. People say biopsy or surgeon can spread cancer. What is the reality?
Biopsy and other things have to be properly planned. Biopsies or testing will not spread cancer. It has to be done in a proper way. We should not burst the tumor and put it in a risky situation. So if you go to an oncologist, I'm 100-200% sure that he will know how it is done. And generally, there is nothing to fear about a needle examination or biopsy, because that is the only way you find out whether it is cancer or not.
Yeah. Does wearing a bra for longer hours causes breast cancer?
That is a myth only. There is no substantiation to that.
Okay.
It is a myth only. There is no truth in it.
Okay. So usually ಜನಗೆಲ್ಲ breast cancer ಅಂದ್ರೆ ಬರೋದು ಬರೀ ವುಮನ್ನಿಗೆ ಅಂತ ಇದೆ. Is breast cancer is only for women or men can get it too?
Even men can have breast cancer.
Okay.
All those who have breast can have breast cancer.
Can breastfeeding really protect against the breast cancer?
See, breast cancer, as I said, is multifactorial. See, when they attain menopause, when they started menarche, how obese they are, what are the things they were exposed to. All these things are important. We just can't catch hold of one point, like if they have 4 children, they are safe. It doesn't work like that, because obesity and all of the factors are there. And with a family history, even with 11 or 10 children, we have seen patients still developing breast cancer. So one factor itself will not give you overall, but there is a protection of pregnancy.
Are natural remedies or home cures effective for cancer treatments?
See, home remedies, I'll tell you, it can help in many ways. You forget diagnosis and treatment, don't take on that. But throughout any lump or swelling, once you get it clarified by a consultant that it is not a serious life-threatening issue, home remedies do help. I'm not running down home remedies. And even during cancer treatment, not to put down home remedies, eating that kashayas and drinking kashayas and fruit juices, majge, and even the digestants like pepper, those all help. So it's not with a blanket statement that home remedies are wrong. Many people chewing lemon pieces, ginger pieces, it helps with the nausea also. And there's so many ginger teas. There is much relief from that, but it should be in harmony with this. That's not a replacement for anything. It all goes hand in hand. That's the way. So you should know what you're doing. Just because somebody said idondu gantide idakke idu soppu enaru juice hakondu hotoguttalla. That's not the way it's going. Get it tested, get it done, find out what it is, and then go ahead. I'm not the one to run down home remedies at all. In the proper place, in the proper situation, very, very valuable.
Okay. Does hair loss means chemotherapy is not working?
See, all there are so many chemo agents. Chemo drugs are big number of drugs. Many have different, all don't produce hair loss. For example, in cervical cancer, when we give concomitant chemotherapy and radiation, cisplatin, what we use, doesn't produce hair fall. Whereas on the patient on the neighboring bed, maybe see a breast with lot of hair loss, full alopecia. So it's not that her treatment is effective, it's ineffective. It doesn't matter at all. It depends which part you are getting. In radiation also, is there no hair loss? Yes, there will be if you are irradiating the hair-bearing areas. You understand? So if I am giving cervical cancer radiation, they are not going to have loss of hair in the head. But which area the radiation is being given? Yes, there will be. Suppose there's a head and neck patient, head and neck area, and we're irradiating the tonsils or mouth. Yes, he will have loss of beard hair, etc. Okay. So whether radiation or chemotherapy, there's no standard statement or standard either for everything, and just hair loss does not mean good or bad treatment, or successful or unsuccessful treatment.
Okay. One last question. What message would you give to the women who are scared of even getting screened?
So women, I would always give the messages, please give importance to yourself, your health. Only when a woman and a family is strong, she is the backbone of the family. You are the main support for the entire family, and the entire family structure grows all around a strong woman. So one day of your life, for example your birthday or something, it's very, very important you dedicate that day for your health. Get checked, get screened. When you are strong and healthy, you can provide excellent support to your children and your family. Don't put yourself in the second place anytime. Make yourself strong, spread strength, give strength.
A big thank you to Dr. Madhavi ma'am for joining us and answering the most common questions people are asking on Google. Your clear and caring answer helped many to understand the topic better. We truly appreciate your time and support. See you again.